Hey fellas, this is not a routine MTP or UroFill short. This is actually a public service announcement. And it's an important one. This is the first one. You will see attached to this announcement our most recent publication looking at the state of male genital cosmetics and how our societies view it. And I think you'll find that the biggest, most important thing is for you to be out of harm's way, meaning away from charlatans, people that pretend to have a fund of knowledge or a skill set that they don't have. And this is our societal ideas. And you have to understand that urologists weren't real keen on doing this about 15 years ago when I first got it started. Now, us urologists, those of us that are in andrology, are taking a big part in this, and that's where you need to stay. So let me tell you something. I went to my kids' what do you call it? When you, the parent-teacher conference. These are my twins, the little ones. And I was impressed at their use of the scientific method. And you all know it, hypothesis, results, conclusions, all that stuff, right? Well, I assure you that 95% of the providers that are doing male genital cosmetics have never used that method, ever. And let me give you just a couple of quick examples. And they're very recent, actually since the publication, which if you look was 5 days ago, Alfie? Yeah, so it was just a few days ago. And I've already had two. One was one of my own patients, a implant patient of mine, wonderful guy, went to get some girth enhancement. He's got an implant underneath. And he called me and he said his implant broken. How could this have happened? And then he tells me about some provider who is a board certified emergency medicine or something like that. I don't know, but he's not a urologist. He hasn't held dicks for most of his life, if you know what I mean. And of course, that's wherein the problem lies. The second one, which is a terrifying one, this is a medical legal case that I've been asked to look at, where this guy gets injected with silicone, and when things go wrong, he has no place to go. He has to go to an academic facility, happens to be a great one, but if you saw the outcome, you would be sick to your stomach. All right, so read this article. Tell your friends, stay away from charlatans. Do your homework. Find out who trained the person you're going to. Find out, how much experience they have, how many are they doing, because this is terrifying. And this is 3 days after this publication. So read it, enjoy it, and this is a public service announcement.